Hi, my name is Zhanna. I'm I'm an FNP student at Maryland University. This is Cindy. I'm going to be doing an abdominal assessment on her. Before you do an abdominal assessment, it's a good idea to ask your patient to empty their bladder so if they don't have a full bladder when you're percussing and palpating. To start, we want to inspect the abdomen, so the patient needs to be laying down supine with arms to the side. A good thing to have is a pillow under their head. I'm going to lift up her shirt, Cindy, I'm going to lift up your shirt. And we're going to be checking for, basically look at the skin color, the symmetry of the abdomen, make sure there's no lesions, scars, or any kind of incisions or anything the patient's ever had. We will look at peristalsis, or the surface motion of which is like the wave-like patterns. We will also inspect for any aortic pulsations. I will check the abdominal muscles by asking Cindy to raise up her head, and we basically look for any masses or hernias or any separations in the muscles and make sure that they're strong enough for her to be able to lift. After inspection, with the abdomen, we go on to auscultating. So we want to look at auscultate all four quadrants. We separate the abdomen into 4 different quadrants. The left upper, left lower, right upper, and right lower quadrants. And here, I will begin by listening. So what we're really listening is for any for bowel sounds, making sure they're normal active, and that the frequency is normal, which is typically about 5 to 30 bowel sounds in a minute. We are also listening for any bruits by checking the arteries, which is check the iliac arteries on each side, and then the femoral arteries, which are down lower. And again, checking for any bruits. Okay, we will also go to the right side and listen for any hepatic rubs, and then closer to the left for any splenic rubs. After auscultation, we typically go on to percussing the abdomen. We are percussing all 4 quadrants again by tapping in each quadrant. We're trying to check for positive tympany so that the cavity is filled with air as opposed to like ascites or fluid. We're also percussing for tone and the gallbladder border, which is underneath the liver, more towards the left. So we'll percuss here the border and estimate the size. We will also try and estimate and check the liver border as well. And what you want to do is you want to kind of percuss up toward going from sounds of sounds of tympany to sounds of dullness, and that's how you check for liver border. And typically it should be around 4 to 7 centimeters. Make sure there's no hepatic enlargements. We will then also listen for splenic dullness, which is and spleen size, which is at the 10th intercostal space between the ribs at the axillary line. So you're again percussing for the spleen, and you will should hear dullness around the border. I will then begin to palpate. We're also palpating the 4 quadrants again. And what's important is that you go from a deep or light palpation to a deeper palpation after that. So we are palpating on the right side below for the liver, and again, the patient may, to make sure the patient's not having any pain or tenderness or swelling. And then we go to the other side to check the spleen, and what typically is you don't want to actually, in a regular spleen, you shouldn't be able to palpate it, or else that means it may be enlarged. So again, checking everything for tenderness, masses, resistance, and then we again go deeper on each side of the spleen and the gallbladder and the liver. Finally, we palpate around the umbilicus area and below a little bit. Basically for bulges, masses, and tenderness. And sometimes when a patient presents with pain or tenderness in that area, it could be a sign of appendicitis, so it's a good place to check for that. And lastly, it is important to percuss the costal-vertebral angles for kidney tenderness, or this can also be sometimes be a sign of pyelonephritis. If I palpate here at the level of the kidneys in a seated position and the patient for some reason jumps because of tenderness, it could mean a possible renal infection. And that completes our abdominal assessment.